A lot of veterans are getting cancer younger, but the way we're screening for cancer and talking about the risk hasn't really changed. This issue isn't about age, it's about risk. Instead of talking to you today, I'm starting the conversation with Ashton, a Marine Corps veteran, international public speaker, and the co-founder of Veteran Cancer Network. So Ashton, tell us a little bit more about your advocacy work.
I started doing advocacy when I was working at Rush University Medical Center on their Road Home program. So it started with veteran PTSD. I then started leading into traumatic brain injuries with pink concussions. And then it just kind of snowballed from there. I got to, really help advocate on veteran issues, mainly, like I said, around behavioral health.
So what was the driving force behind creating the Veteran Cancer Network?
Well, honestly, it started with you being, at Rush Hospital going through chemotherapy, and how long it took for us to be able to actually get that diagnosis. I know that you had spent, months, advocating for yourself at the VA healthcare system in Illinois. You weren't really getting anywhere. It took you getting the diagnosis outside of the VA, which, we kept on talking and, realized that there was a really big problem. Even though you were self-advocating for yourself, the doctors that were there weren't taking you seriously. So, through all of our conversations that we were having, we wanted to be able to start something, that, was more along of what your exposures had, basically brought you to. So, between the deployments to Iraq and, the radiation leaking in the squad bay and all these, factors that, help lead, you to your cancer diagnosis, we realized, that, your story isn't the only one. The more that we were talking with other veterans about what you went through, we realized that there was a problem, especially whenever it comes to age-based assumptions. So we decided to form the Veteran Cancer Network to really advocate for others and help push policy, at the government level, to help other veterans not go through what you went and actually be able to say, hey, I was exposed to X, Y, and Z. I have these issues. Can you at least test me or screen better for cancer or for other health issues, autoimmune, whatever. But for us, cancer is our talking point right now today, I guess.
It's definitely our talking point. It's a long, lonely road without the proper support system put in place when you're hit with a major illness and you have to just navigate and figure it out on your own. So we're trying to build the resource hub, the network that would have benefited us during those desperate times. With the advocacy work that Veteran Cancer Network is trying to do, what resources or what programs are we trying to connect veterans to?
That's a great question. So, what we realized when we were going through our cancer journey is the lack of resources in the veteran population, specifically to cancer. And so for our main goal, obviously, is the advocacy, trying to get that systematic level change for early cancer detection through, various, screening methods. And we chose to work with an organization that does multi-cancer early detection blood tests. So it screens for over 50 different cancers. And obviously our goal is to be able to have that put into the VA healthcare system for any veterans that have been exposed. Ultimately, it'd be great to have it a part of the annual healthcare exams every time you go to do your blood work or whatever, be able to get that done. But we don't want it just to be that. What we have realized through our research is that there is a lack of communication within the veteran population. So not all veterans use the VA healthcare system. Whenever it comes to cancer in the military community, you also have the active duty component, and then for those that are not a part of any of that, they are, utilizing civilian hospitals, civilian doctors' offices. So none of those communication efforts are actually, being brought together through all three entities. So for a veteran that gets cancer, let's just say through the VA healthcare system, they actually get, put on a, registry, and it just actually happened in the last few years where the DOD and the government is actually tracking that. On the military side, on the active duty component, they have that same thing. And then, for those civilians, they're actually going through their state CDC. But none of those systems are talking to one another. And that's actually going to be causing a problem whenever it comes to identifying veterans' cancers, long-term studies. And if we can't properly identify a problem, then how can we go about treating it? So obviously that's our my big number one, thing is being able to find a place where we can all communicate, share research, share data, to be able to help identify those problems. But on the other side, when you were going through cancer, there was a lot of, unknown, with that whenever it comes to resources and having to navigate the VA healthcare system and navigate the nonprofits that are out there to be able to help you. And so, for us, we want to be able to build that community where veterans and caregivers can come ask questions, through people that have had that lived experience, organizations that are wanting to be able to help, on that collaborative movement. And then on the other side, when you're going through chemo, it's a really scary, part of, going through the whole treatment is because there is like, oh my gosh, am I going to be sick all the time? Am I going to get sicker because of an infection like what you went through? There's just so many unknowns on there. And I know that when you were going through chemo, you were gifted a really nice care package. And so we're wanting to kind of give back that as well, offer, veteran specific cancer care kits, basically, just to be able to kind of look through while you're going through chemo. So there's a lot that we're doing behind the scenes, and we have a lot of growth to be able to do to be able to get there. But at the root of it, we just want to be there to help, the veteran family as they're going through and get, through the scary diagnosis.
We're also doing a initiative this summer, and I'm going to let Ashton talk to you a little bit about what Pedal for Impact is.
Yeah, so Pedal for Impact, we actually went to the Military Influencer Conference, and we had met a gentleman that actually bicycled from California all the way up to New York, and it was mainly for, suicide prevention among the veteran population, PTSD, and it really struck with, the both of us actually on that, and, because he was able to meet with so many different people across the nation, talk about his story and what he went through, and I was like, we should do something similar. Now, I'm not going to go all the way from California to New York, but it got me sitting there thinking, how can we sit there and be able to bring the community together in a healthy way? Now, I don't know if bicycling in the summer, could be the absolute healthiest on that one, just because it's going to be really hot. We'll drink water, I promise. But we wanted to be able to sit there and bring our message in a in a different way. I mean, anybody can drive to Washington D.C. or take a motorcycle ride or whatnot. But we wanted to be able to kind of slow down and really build the community and talk about what Casey's gone through and other veterans have gone through. So Pedal for Impact was formed, and this summer, starting June 13th, we are going to be bicycling from Jacksonville, Florida, all the way to Washington D.C. Doing just that, meeting with the community, meeting with VA healthcare, different legislators. And then when we get to D.C., we will have a team of healthcare professionals. I know Dana Farber is going to be joining us in a future podcast. But they're going to be, working with us and basically telling Congress and telling the American people that, hey, this is a real problem. And, there is a way to be able to help fix this. So that's kind of why we're doing this come June.
So we wanted to pick a form of travel, but we didn't want to Forrest Gump this. We didn't want to walk. We didn't want to run. And based off of my residuals from chemo, I have some problems with my hips. So it was suggested to do bicycling, and that's a good form of exercise for my situation. So after we do our big ride this summer to Congress, what are we looking to accomplish once we get there? Like what aspects are we trying to change?
Well, yeah, that's a great question. I personally think that, the issue of age-based assumptions, especially whenever you compare it to the social determinants of health, which means the things that you're exposed to, your family life, those type of things. But for the veteran community, we know that we've been exposed to toxins and, various different health risks, throughout your military career, whether it's just been, a few months at boot camp all the way over to, multiple deployments and so forth. So for me, I think it's going to be really important for Congress to be able to, one, hear stories from the veteran community about what they were exposed to, the problems on how they got, through the VA healthcare system, because there's always one, no matter what, but specifically related to that age-based assumption. So like when you were going through, your diagnosis and you were complaining of your back pain and everything, the big factor that I kept on hearing from you is that, they keep telling me it's in my head. When if they had just done some imaging, they would have, been able to see that grapefruit-sized tumor, growing right next to your back, on your back. So when we get, when we're at Congress, I think it's important to have that storytelling, but then also partnered up with, the research and the data that's there along with the solution. So with GRAIL, they have that, blood test, that multi-cancer early detection test, and they screen for over 50 different cancers. Now, that screening does not mean that, that's a diagnosis. That just means that, what they're seeing in the blood is showcasing that, that it appears that you may have a cancer, and they'll potentially pinpoint a specific type of cancer. It is up to you to go to, your primary care provider to be able to actually get that diagnosis. And a lot of that time it's done through imaging. Like your cancer, you would not have been able to get a simple blood test through the standard panels because it didn't show up. And that's how it is for a lot of different cancers out there. So what we're looking at is seeing what the risk factors are, for the individual veteran going through, the treatment process through the VA healthcare system or the screening process, and pairing it up with that multi-cancer early detection. And I think that's important for Congress to be able to see that is that, one, there is an issue, obviously, that more and more veterans are getting cancer at a younger age. So like for the post 9/11 generation, we're seeing it a lot younger than the pre 9/11 generation. A lot of them that were exposed to Agent Orange and burn pits, they were getting cancer, in their 60s, 70s, and 80s, while, we're seeing it in our 30s and 40s. And with the age-based assumptions that are out there right now, most screenings aren't happening until, 45, 50 years, of age. So, that's really the goal is, when we get there is to identify the problem and show them that there are solutions that are out there.
That's an ambitious goal, and I know we can accomplish it with the right people by our side. But what we can do right now is we can locate resources for veterans before, during, and after. What kind of organizations are we focusing on to collaborate with right now?
So I think it goes beyond resources too, because not every organization, is able to sit there and provide a specific thing for, veterans on the upfront. A lot of it can be through like advocacy, but in general, the organizations that, we've been outreaching with. So obviously you have, the healthcare systems, reaching out to like Rush University Medical Center, Mass General Hospital, organizations that are already looking at multi-cancer early detection tests, obviously are key on who we're going to be reaching out with. Other organizations are the ones that are actually in the veteran community fighting the good fight, So, in conversations with like Wounded Warrior Project, the American Legions, VFWs, Hunter 7 Foundation, I would love to be able to sit there and have a conversation with them. But really organizations that are interested in, basically early detection cancer, treating cancer, veteran population organizations, really just anybody that, is interacting with the veteran population is our big goal. But then also caregivers too. So I think that's important, because it's a full family fight. It's not just an individual, that is fighting cancer. And then obviously the advocacy groups. We're talking with government legislators, because without their support, there is no way that we can get this passed in Congress. But anybody and everybody is really who we want to be able to talk to, because there are so many veterans, or people that have served in some sort of capacity in their family that, could benefit from this. So really, our focus is pretty much everybody, for-profit, nonprofit, government, you name it. We want to have that conversation.
So looking back during my cancer journey and you being my caregiver, what advice would you give another caregiver in that situation?
Oh my goodness. Honestly, I think, it was so incredibly stressful the entire time, and so like, when you were going through, your treatment and everything, we had a lot of, just unknown moments. But then we also had a lot of times that we were able to reconnect. Because we have life that got in the way. And so I like to sit there and say that cancer is probably the best, worst thing that ever happened to us. And that's just because that we were able to, sit there and kind of laugh through the hard times. Like, I will never forget when you were sitting there looking down at my feet and I had those socks on that said crushed it and had the nutcracker on there. And you sat there and you brought everybody in, to sit there and kind of talk about how, that's so offensive. Mind you, he had testicular cancer, guys, so he had to get his testes removed. But yeah, I mean, that was just our very first, time that we actually laughed. And I think that was also a really big part of the healing journey, both for me and for you, because we laughed probably more than, we cried, I think. I don't know.
Yeah. I think there was definitely some hidden tears in that, but yeah, I definitely had so much fun laughing at that. That part was a fun time, but you got to see the silver lining in it, and that's the biggest thing. Well, with that small talk today, I think that's the end of it. Thank you so much for joining us. We're going to be doing plenty more of this, I'm pretty sure, Ashton and I. So we'll catch you on the next one.